Alright, so today we're going to talk about newborn nutrition by Professor Diaz. So first we want to start talking about breastfeeding. So for breastfeeding recommendations, breast milk is nutritionally superior to commercial formulas. The American Academy of Pediatrics recommends exclusive breastfeeding until 6 months of age. And when we mean exclusive, we mean that there's no supplementation of formula. So we don't give formula, we don't give water, juice, or cereal. It's just strictly breast milk. All breastfed babies who are exclusively breastfed or even partially, sometimes they should receive 400 IUs of vitamin D. So usually it's just a supplement that they get over the counter. It's like a liquid form, and they provide this to babies. They also recommend for vegetarian breastfeeding mothers who exclude meat or fish or dairy products should provide vitamin B12 supplementation to newborns. And again, this is just extra nutrients that sometimes that the baby may need that the mother may not be able to produce as adequate in the breast milk. But after 6 months of exclusively breastfeeding is when we start to introduce complementary foods. So we usually start off with the iron fortified cereal. It's not like your usual cereal that we eat. This is kind of like almost like a oatmeal kind of consistency that they start feeding babies, and it's rich in iron, and that's given in continuation of breastfeeding until at least 12 months of age. And usually at this time they'll start to introduce vegetables, pureed fruits, and so forth. It's not until after 12 months is when they start to introduce cow's milk to babies. But anything before 12 months, it's contraindicated to give cow's milk. So that's where the breast milk comes into play. And usually moms can continue to breastfeed even after the 1 year. It's not like they have to stop at that point. It's really to the mother's discretion at that point after the year. The Healthy People 2020 goals, what they want to do is increase proportion of women who breastfeed their babies. So one of the initiatives is to do a lot of patient education. So when they come into their prenatal visits, we want to start having that conversation, not when they deliver the baby, but beforehand, to start giving them information on breastfeeding and the benefits of breastfeeding, because they saw that early on this education gets them thinking about what they want to do. And usually a lot of moms will start to seek prenatal classes or breastfeeding classes so that they can educate themselves on more about the benefits of breastfeeding. Currently in Chicago, we have a hospital that is baby friendly, and what that means is that it's like a status, kind of like a magnet status, but this is just focused on breastfeeding. And basically, that that status that they give them is that they're big champions for breastfeeding. They promote breastfeeding throughout the hospital. A lot of people think that it's just exclusively to labor and delivery or mother-baby or NICU, but you realize that breastfeeding moms can come at any entry port in the hospital. You know, sometimes you're going to have a mom that's sick, that has to be in the ICU. She can be in med-surg. She can be in the pediatric unit with her baby. And so one of the things that you find is that they might not necessarily be trained staff to support these women. So the Baby Friendly initiative, what they do is that they actually train the entire hospital staff and everybody so that they know that if this, what to do for breastfeeding moms, how to support them. And it's a really hard thing to achieve. Many hospitals have been trying to do it for years, but actually a little company in Mary was actually successful in obtaining that baby-friendly status. Alright, so let's talk about the benefits of breastfeeding. For maternal benefits, it promotes involution, which the reason how this happens is because one, oxytocin is what we talked about in labor and delivery, the hormone that is produced to cause contractions for the woman to expel her baby. But oxytocin also serves as another purpose. It actually causes the ejection of the milk, that letdown reflex. And so what happens is that when the woman starts to breastfeed, it causes her uterus to contract. And so even so, that's why they recommend that women should breastfeed their babies within a half an hour to an hour after she delivers, because that's going to help with decrease the risk of postpartum hemorrhage, because you're getting this extra double whammy of that oxytocin that's causing that uterus to contract. Because remember, the placenta detaches from the uterus and it leaves those open blood vessels, and so this is going to help contract them a lot better so that it prevents that postpartum hemorrhage. And in turn, for these women, they actually lose weight faster, for the reason that it causes their uterus to go back to pre-pregnant state a lot faster. So usually after you deliver a baby, their uterus is almost like the size of a cantaloupe, and so it takes about anywhere from 4 to 6 weeks for that to actually for it to go to a pre-pregnant state to like a shape of a pear. And so since they're breastfeeding, that process happens a lot faster. And so, you know, some of these women can lose their baby weight sometimes, depending on, as long as they maintain adequate weight gain during pregnancy. So sometimes they can lose that baby weight up to even 2 weeks later, or sometimes a little longer than that. But and that's one of the benefits of that. Now, we don't want to ever say that it's like a weight loss program, because it's not. Because if a person is overweight during pregnancy and she gains 75 pounds, then she can't expect to lose all that right away, but it can definitely help. Okay, so we just got to be cautious in how we educate our patients. But one of the things that it does is decreases the risk of ovarian breast cancer, osteoporosis, rheumatoid arthritis, cardiovascular disease, and it also promotes bonding with baby. And a lot of women who breastfeed have less risk of postpartum depression, because again, this promotes bonding in the way that, you know, in pregnancy the mother is a lifeline to that baby, and so this mother is continuing to be that lifeline to the baby, because her feeding her baby is going to help her baby grow healthy and just grow. So for these mothers, they and also they feel a sense of that this is what they're supposed to be doing, because it's natural to breastfeed. And I think we've tried to move away from that stigma of that breastfeeding. Some people may not necessarily think it's natural sometimes. Some people may be grossed out by it, and so so this actually promotes that this is a natural thing to do. This is what the breasts are made for, because as soon as women deliver their babies, their bodies start to produce this milk. So that's one of the benefits of that, was that bonding. But some women, when they're not successful at breastfeeding, sometimes that may make them feel a sense of guilty or feels inadequate because they weren't able to do that. So, we as providers, we need to be supportive towards these moms and tell them that they're doing a great job, and not be so judgmental, because sometimes that can be perceived as a mom chooses not to breastfeed, and then they can be made to feel guilty, and that's not our job to do. Our job is to support these moms in whatever decision they do. But of course, if they decide to breastfeed, we want to support them as much as possible. So usually most hospitals will have a lactation counselor, or they'll actually have peer counselors for breastfeeding. Usually they'll have the nurses trained to be CLCs, which that's what I got certified to be, is a certified lactation counselor, so that we can support these breastfeeding moms. The other benefit for them is we have a lot of economical benefit. It's obviously free. They don't have to pay for their breast milk. They save hundreds of dollars per year spent on infant formula, because infant formula can be very, very expensive. Literally, like a can of formula can cost anywhere from like 18 to 20 bucks, and sometimes it can only last for a week. And usually we have programs like WIC program, which is for women, infant, children. It's a nutritional program that state has, which this is only for women who qualify for these services, and they have to have a certain income to be able to qualify. But what people don't realize is that that's not a program that provides formula. It provides nutrition for both mom and baby. but they want to encourage the woman to breastfeed. But if they choose not to, they'll provide formula, but they don't provide all the entire formula that the mother needs. It's only a supplemental program. So they may have to purchase some of the formula because it may not provide all the nutrients for the baby. So, but again, those are only people that qualify for that. So that's why it can be very costly to give formula. Usually, babies who are breastfed, they have fewer illnesses because it provides a lot of protective factors and immunity. So when they are less likely to be sick and less likely for the parents to have to take sick days to stay home with their ill baby, and it's less insurance claims for that reason as well. And also, there's not necessarily, they don't need to spend too much money on purchasing bottles and nipples and nursery water, which is water they mix the formula, because again, they don't really need that unless they choose to expressly pump their breast milk. So the infant has a lot of benefits. It provides immunological properties that protect newborn from infections and strengthen the immune system. There's no commercial formula that has exact nutritional composites of breast milk. It provides the right nutrients for growth and development. It's very easily digestible and it does not cause allergies. Breastfed babies rarely get constipated. It promotes mouth development. It eliminates risk of contamination from water supply or improper dilution, especially when you're mixing the formula. Promotes elimination of meconium because it acts like a laxative and it lubricates their intestines. It allows them to have a lot more stool a lot easier and a lot faster. It also improves brain development, so that's a good benefit for babies as well. It decreases the occurrence of childhood respiratory disorders. They're less likely to have asthma. Decreased risk of SIDS, which is sudden infant death syndrome. So this is what we call the crib death. So a lot of these babies, they're awake more often. So when they're awake more often at nighttime, they're less likely to have some die, during their sleep. It also promotes a lot of bonding with mom. There's also lower incidence of following diseases such as GI infections, because again, it acts like a lubricant. It protects the baby's stomach, and because sometimes formula can be very constipating for babies. It decreases the risk of celiac disease, asthma, lower respiratory infections, otitis media, which is ear infection, diabetes type 1 and 2. And the reason for that is because these babies feed on demand. So they're constantly, their metabolism is maintained throughout. And versus like a formula, they're fed more like every 3 to 4 hours. And a lot of times parents think that they look at the bottle and the amount of it that they have, that's how much they should consume. And sometimes they end up overfeeding these babies, and which can be problematic. They're less likely to have allergies, childhood obesity as a result of they're not being overfed, and also leukemia. So if you look at the picture, there's so many more benefits of breast milk than as opposed to formula. Breastfeeding contraindications. So usually any woman that's using a legal drug should be contraindicated for breastfeeding because again, that can pass through the milk to the baby. Active untreated TB, HIV, chemotherapy treatment, hepatic lesions on breast, or a woman or a baby who has galactosemia, which is an inborn error of metabolism that requires a specialty formula since babies lack that enzyme to break down the sugar in milk. So overall, except for those reasons, every woman can breastfeed. So how is the breast milk produced? So basically what happens is that we have two hormones that actually causes production. So usually what happens, if you look at the picture, the baby stimulates the nipple by sucking, and that sends its message to the hypothalamus, to the brain. And so the hypothalamus is what houses the pituitary gland. The pituitary gland releases two hormones, which we have prolactin and oxytocin. Prolactin is actually what releases the milk into the breast ducts, and the oxytocin is what causes the letdown reflex and allows that milk to eject into the baby's mouth. Again, this is a supply and demand. So it's as long as the baby keeps coming back to the breast, the mom continues to breastfeed the baby, it's going to stimulate the breast, and that's going to cause milk production. The minute that the mom stops to put the baby on breast, or there's no stimulation like by pumping, then that's when her supply starts to dwindle. And so that's why we always tell moms to, put baby on breast, or at least if you're going to be pumping, make sure that you don't miss any feedings, because that's what causes the milk to diminish. So you got to think about it like in business with the supply and demand. If there's a product on a shelf that people want, and as long as people continue to buy it, the company's going to continue to manufacture it until it's no longer wanted. And at one point, if there's no longer wanted, or those sales diminish, then they're not going to less likely to produce as much of this product. And so that's kind of how it works with breastfeeding. So again, oxytocin causes the uterus to contract because it's doing two things. It has two roles. And so that again is promoting that involution, which is causing the woman's uterus to go back to pre-pregnant state. So a lot of women, especially your multi-gravid moms, may feel her uterus feel those contractions. It may hurt because it's causing those contractions to be a lot more stronger, because it's causing that uterus to go back to its pre-pregnant state. And remember, it's a muscle, so if it's overstretched because of multiple babies, it takes a lot harder for it to go back to its pre-pregnant state. But it really helps with that involution and also preventing that postpartum hemorrhage. So here we have colostrum, which is the first milk that is produced, which we usually call it the liquid gold. It can be yellow to clear in color. It has high proteins and minerals. It's low in fat. It provides protection by containing antibodies and passive immunities. It's very easily digestible, and it's beneficial in loosening mucus in the baby. And again, it serves as a laxative and helps clear the baby's intestinal tract. So usually this helps them have that first stool within 24 hours, which we call meconium. And it also coats the stomach and intestines and protects against invading organisms. So this is why they're less likely to have any GI problems or constipation. So colostrum is produced immediately after birth and occurs for about 3 to 4 days. And then the milk changes to transitional milk. So approximately about 10 to 15 days after birth, mature milk production begins. So usually in this picture, you'll see the first milk that comes out when the baby starts breastfeeding is what we call foremilk. So it has this bluish tint. It's the first milk the baby receives during the nursing session. And then it progresses to hind milk, which is more that the whiter milk on your right side, and that has the higher of fat, and this is what causes the baby to be satisfied. So sometimes when the mom will pump milk, it actually will separate, and you'll see how the hind milk and the fore milk and how it separates in the bottom. So one of the things that we got to do a lot of education to moms, especially our breastfeeding moms. So one of the things is we want to identify hunger cues and when the baby is hungry. So there are definitely a lot of cues that the baby will tell the mom so that she knows that it's time to feed. And so the mom, one of the things that she needs to learn is these feeding cues, because she wants to, start to initiate the feeding. Because the last thing she wants to do is wait till that baby cries. Because usually when the baby cries, that's an indication that the mom is not attentive to the baby's feeding is not being met, so they will cry, and usually it makes it a little harder for the baby to latch on to the mom, and usually the moms can get a little frustrated because baby's not latching and feel bad. So that's why we want to teach them these hunger cues that they can identify. So one of them is hands to mouth movement. They'll start to open their mouths. They start stirring. They start to turn their heads. They start making sucking sounds. They'll start rooting. So if you touch their cheek, they'll all of a sudden move their head towards the breast. They'll kind of stretch out. You'll see them move and kick their little legs. Sometimes they'll have their fists really clenched. And usually, again, the late sign is starts crying. They get very agitated, start turning red when they're super hungry. So again, we want to educate moms on those feeding cues. So there's different types of positions that the moms can be in for breastfeeding, and we want to make them as comfortable as possible. So a lot of times we'll have a pillow to help prop the baby. Usually now they have these boppy pillows which kind of hug your hips so that it can provide like a supportive pillow for the mom. So we have what we call the cradle hold, which is the top left, which is the tummy to tummy rule. Okay, so usually we want to make sure that the baby's facing the mom's breast and that her tummy is touching the baby's tummy. So that's like a good position to put the baby on. Another position is a cross cradle hold, which is that all you see, which is the picture on the left, on the I'm sorry, on the right. And that is the mom is all the differences is the way she uses her opposite hand to hold the baby, and she's just using her other hand to hold her breast. Then we have the football hold, which is literally like if you were holding a football. It's kind of underneath your arm, and you usually put like a pillow also to support the baby. And what you want to do is hold the baby's neck so that it kind of gives you the control of the baby's head. And usually this is a good position for women who have really large breasts, or a mother with twins, or if a mom has had a C-section, so that you don't want to put the baby on the abdomen because it might hurt her incision. So you may put her in the football hold position. Then you have the sideline position, which this one provides for maternal rest, or again for C-section moms. We just want to educate our moms that when they're in sideline position, that they need to be careful that they don't fall asleep, and especially if they're at the edge of the bed. We usually say that the mom lay all the way onto her at the edge of the bed so that the baby doesn't roll off the bed. So if she's all the way on one side of the bed and the baby, if whatever reason the baby's still on the bed, so that the baby doesn't roll off. Usually we tell moms, have their own little like a bassinet or a crib nearby so that you can place the baby back in the crib, so that again we can prevent the baby from falling off the bed. So what are signs of a good latch? So one of the things that it's important that we teach our moms is good latch, because if the baby is not latched properly, this can cause a lot of trauma to the nipples, and it can be very painful for the mom, and sometimes it can discourage the mom from breastfeeding. So, and initially in the beginning, I always tell moms, it's like riding a bike. Sometimes it takes a little while to get used to. Sometimes you might fall off the bike, but then just got to give some time, and with time, it will get better, and you'll eventually get the hang of it. And so one of the things we want to make sure is that we have a proper body alignment of the infant. So again, tummy to tummy. And the infant's mouth is wide open for areolar grasp. So usually what we do is tell moms to tickle the baby's nose, and it should be aligned nip to nose. Okay, so, and usually once they tickle and sometimes they can express a little milk, so that kind of initiate for the baby to open their mouth really wide. You never want to come in like a dart, okay, like straight in. You want to kind of angle the baby's head so that the baby can open its mouth wide, and it actually can put in the entire breast as well as the areola into the mouth. So if you can look at the picture A, you can actually see how the baby is kind of on an angle position and has the entire breast in the mouth. So, and that makes a difference because the baby's able to actually stimulate the breast and suckle the milk out. Usually you'll have rhythmic motions. So you'll see the baby's little ears wiggle, you'll see the jaw rocking, and you'll hear audible swallowing heard. And usually if the baby is drinking milk, it will also be relaxed, and then eventually it'll appear satisfied. So usually one sign is that they'll have those clenched fists, and then all of a sudden they'll usually have their hand on their mom's breast, and then usually as they're getting full, they'll start to relax their hands, and they're not as clenched, and then will either fall asleep on the mom. And another sign that mom knows that the baby's feeding is that she doesn't feel her breasts start to feel soft. They're not feeling as full, as engorged at the end of the feeding. If a baby is not latched properly, if you look at the letter C, the box, look at how the baby kind of just comes in like a dart, and the baby has the actual nipple in the mouth, and so this is what causes that trauma. And so when the baby just has the nipple in the mouth, it's actually not allowing for the baby to express the milk, as the picture above. And this again, when they have a poor latch, it actually is painful for the mom. Normally it shouldn't be painful for the mom. So that's why we sometimes tell moms, you know, they can grab their breast in like a C position. I mean, pull their hand in a C position and kind of squeeze their breast to kind of get it in the baby's mouth. That kind of helps. But if they have a poor latch and it's hurting, then they need to relatch the baby. So one of the ways that they can do that is take their clean finger and just put it on the corner of the mouth to break the suction. Because otherwise, if they peel the baby away, it can cause nipple trauma. So we want to avoid that. Okay, so one of the questions mom always asks is, how do I know my baby's feeding enough? Because usually, like I said, we're used to, like when we see a bottle and we put something in, or just a cup, or just think of a cup, you put something, you can measure it by how much somebody drank because whatever's left. Well, with breastfeeding, you really can't tell. So the only way that the mom has to identify how babies are feeding well is a couple of things. Usually they will have a letdown, that milk's dripping from the breast when feeding is due. Usually after the feeding, they're going to feel their breasts softer. They're not as firm because you know, they're not as full anymore after the baby has fed. Usually the baby will nurse about 10 to 15 minutes per breast for at least, you know, usually they should have at least 8 to 12 feedings per day. Usually the mom will hear audible swallowing is heard when suckling, and usually after the feeding the baby will feel relaxed and sometimes will fall asleep. You'll also be able to know if they have 6 to 8 wet diapers per day. So that's another indication that's feeding, the baby's feeding well. Infant passes stool several times a day. Usually breastfed babies have at least 3 or more poopy diapers in a day. And again, because it forms as a lactative, you're going to notice them to have more stool. Again, they have weight gain as well. Usually newborns will lose no more than 5 to 10% of their birth weight and return to birth weight within 7 to 14 days of age. So usually these babies, and it's normal because think about it, in the beginning and in pregnancy, they're dependent on the mom for the feeding through the umbilical cord. So now they're having to learn how to feed. And so their stomachs are really small in the beginning. So if you look at that day one, it's like the size of a cherry, their little stomachs. And then as the week progresses, it starts to get a bigger and expand, because they are starting to eat a little more and more, a little bit more and more, and they start to become more satisfied a lot more versus when they're constantly feeding so frequently, when like say like day one. So sometimes that weight needs to catch up to them, and so you know it's normal to lose that weight. So every day they're weighing the baby while they're in the hospital, and then at 2 weeks they usually come back to the hospital. I mean, sorry. After they get discharged out of the hospital, they usually come within a week to also get a checkup with their pediatrician, and then they return again at 2 weeks, and then usually at a month, and then every 2 months from there. Because again, they want to make sure that they're feeding well, and they want to make sure that they identify if there's anything going on. If the mom is having any breast issues, then they can address them. So the average baby then gains about 1 ounce per day for the first month, and then about 1 or 2 pounds a month until 6 months. So usually the general rule is that most babies will double their birth weight by 6 months. So if they're 7 pounds at birth, you know, by 6 months they should average out about 14 pounds, okay? And then triple it by a year, okay? So how often is baby fed? So again, baby feed on demand. Generally, they should have 8 to 12 feedings in a 24-hour period. Okay, so about an average every 2 to 3 hours. But again, there's times where baby may feed more often than that. They maybe feed every hour, and especially if they have cluster feedings, it's when they actually when they're going through a growth spurt, they might feed a little bit more often, or if babies are a little fussy, or sometimes if they're sick, they might feed a little bit more often than usual, which is okay. That's why they say they feed on demand. The infant should nurse again about 10 to 15 minutes on both breasts. Sometimes babies will only feed off of one breast at a time. If they do, that's okay. We just got to make sure that the mom on the next feeding will breastfeed on that side, the side that didn't get fed on, and sometimes we have them use like a safety pin or put a little rubber band on one wrist so they remembered when to feed next, just so that they don't what you call it, so that they don't forget. And sometimes if it's really uncomfortable because that breast is not emptied or engorged, sometimes we can recommend that they pump as well. So generally for if you have to burp a baby, usually babies can get fussy and get cranky because they swallow air during feedings. This usually occurs more for bottle-fed babies, so it can, but it also can be for breastfed babies, but not as much as for breastfed baby, because usually what happens is that they're not getting all that air in the they're not swallowing air like they do in a bottle. But a mom could pump her breast milk, and so she might have to bottle feed. So what we do is we want to make sure that um, breastfed babies are burped in between when they're switching them around. But again, like I said, they don't swallow that much air, so they may not burp, but you can just do it as a habit in between breastfeeding each breast. And that can also help promote the partner to be involved too. So while the mom's breastfeeding, they can give the baby to the partner. After they finish breastfeeding, they give it to the partner, and then the partner can burp the baby and then return the baby to the mom to feed on the other side. But definitely if they're bottle feeding, whether it's formula feeding or giving them express breast milk, they should at least burp after every 2 to 3 ounces, or at least when it's half the bottle, like at least halfway through the bottle. So again, so that can help them burp, because otherwise sometimes these babies will more likely to spit up or sometimes throw up because they're too full. So what is engorgement? So this is engorgement is a swelling in the breast that occurs when the breast starts to produce milk. And so what happens is that sometimes when the milk is producing, it may cause the woman's breast to feel really full. Sometimes it can be very hard. It can be warm to touch, and it can be very painful. And usually this occurs because either they miss a feeding, or sometimes the mother just can produce a lot of milk and get really fast, engorge really fast. So frequent breastfeeding best is a way to prevent this. Okay, so ensure a good latch to provide emptying of the breast. Usually we tell them to do warm compresses before a feeding, and also to manually express their breast before this feeding, because then again that's going to help, that stimulation is going to help draw that milk out and make it a little easier for also the baby to latch on and feed. And if they're still feeling a little bit of engorgement afterwards, then we tell them they can do cold compresses, or cabbage leaves, believe it or not, has a lot of benefits. So what they usually do is they take these cabbage leaves and wash them, and then leave them intact, like they're little like cups. And so what they do is they actually will put them in a Ziploc bag and put them in the refrigerator. And the cabbage leaf actually has an enzyme that it actually goes onto the breast, and it actually reduces that engorgement that a woman may have. So just kind of a natural remedy that we teach our moms. Oops, sorry. It's my game. Sorry. I mean, sorry. Sorry about that. So that's just I guess it was my game that I had playing with this lecture. So anyway, so storing and freezing breast milk. So one of the things that if a mom decides to pump her breast milk, there's certain general guidelines in terms of storing and freezing breast milk. So if the mom expresses milk and decides to keep it at room temperature, she doesn't want to keep it at room temperature no more than 8 hours, because then again that increases the risk for bacterial contamination. She can safely store the breast milk in either glass or hard plastic containers, or they have actually little bags that you can also store them in. Milk should be stored, if they're going to store it in the refrigerator, it should be used within 8 days. It can be frozen. If you choose to refrigerate it in your freezer, and then you can have it up to 6 months. But we tell moms to put it all the way in the back of the freezer in the refrigerator, just because if you're constantly opening the refrigerator, it sometimes can exposed to the hot air. So that's why we just have them put them in the back. If they have a deep freezer, then that can last up to 12 months. And a lot of moms, sometimes they start storing their breast milk, especially if they know that they're going to be going back to work and they want to have that enough breast milk. So they start doing that early on. It can be thawed in the refrigerator for 24 hours prior to using. Um, we always tell moms that we never microwave the breast milk. It's not advised because it destroys immune factors in the milk, and it also creates hot spots. So they should always thaw in warm luke water or in a running warm water. It should never be boiling, okay? Because again, that can kill those, destroy the immune factors. So, and sometimes now they have warm bottle warmers that actually can heat up breast milk as well. And we do not, once they thaw out that milk, they should never refreeze it. They just need to discard it at that point. Okay, so nutrition for breastfeeding mothers. So mothers need an additional 450 to 500 calories that include the calcium-rich foods. They should be drinking 2 to 3 liters of fluids per day. They should also include 200 to 300 milligrams of omega-2 polysaturated fatty acids in their diet to provide adequate DHA for infant in the breast milk, because that helps with their brain development. Some foods eaten by mother may cause a change in the taste of the milk or cause the infant to develop gas. So again, they should be able to eat the regular foods that they eat, but they just need to be careful. So sometimes like gassy foods like broccoli or cauliflower can cause the baby to be gassy. So just want to just keep an eye out when they eat. Medications by the mother may be secreted in the breast milk, so they always need to consult with the provider before taking any medication or over-the-counter supplements. They can continue to take prenatal vitamins as well because, again, they continue to provide nutrients to mom and baby. One of the things we want to do is avoid alcohol or drug use because, again, that can be passed on to the baby. So we don't know what alcohol amount is safe, so we just recommend that they don't consume that during while they're breastfeeding their baby. So here's the food pyramid for breastfeeding mothers. So again, you're not expected to know how many cups of fruit or anything like that, but this is just to give you an idea of how to have a healthy nutrition while they're breastfeeding. That they should still eat their fruits and vegetables, grains, meats and beans, and milk. For some women that we also may recommend teas like fenugreek. They have different kinds of other teas that they can take that they found that can also help with breastfeeding to promote more production, like oatmeal and some types of trying to think, like they're like oh my god, like horchata, stuff like that can also help produce milk as well for these women. So there's a lot of home remedies out there that you may hear. Okay, so let's talk about formula feeding. So there's many reasons why women choose to formula feed. So some women may stop breastfeeding and have to resort to formula feeding due to either they're taking some kind of medication that can pass on through the breast milk that could be potentially harmful for the baby. If they have some kind of surgery that may, like a breast surgery or something that may cause them to not be able to breastfeed, working sometimes can cause a woman to stop breastfeeding. Usually, there are laws that protect breastfeeding mothers, so, they are allowed to have an additional break to be able to pump their breast at milk, and they are required, your employer is required to actually have a room for you to pump your breast. You should not have to do it in the bathroom. Some women, their milk supply may diminish because, again, if they're not constantly causing that stimulation on the breast, whether it's via the baby suckling on the breast or the mom pumping their breast, that can also reduce the production. If the mom is having breast or latching issues, that can again help, may cause the mom to stop breastfeeding. Some women may just feel like they're restrained by breastfeeding or feel that the baby's too clingy, that they may not want that. Or sometimes women or partner may perceive breastfeeding as a sexual nature or distracts from women's sexuality. So again, there's many reasons. And some people may believe that formula may be easier for women to quantify how much infant consume. It may reduce worry if baby is getting enough milk, and it may be easier to feed, and partner can feed baby too. So again, these are things that the mom just needs to identify which is better for her and her preference. One of the disadvantages of formula feeding is it lacks antibodies, so formula does not provide the baby with the added protection against infection and illness that breast milk does. It is expensive, so during the first year of life, the cost of basic formula can run about $1,500 or more. It's possibility of producing gas and constipation, so a lot of these babies may suffer from constipation, so sometimes the mom may have to change the formula several times to find something that may agree with the baby. And the organization and preparation, so usually the moms have to carry bottles and nipples. They must be sterilized before the use and then washed after every use after that with the hot soapy water. Then you have to decide on whether they want prepared from powder, concentrate, or ready to use formula. And usually they have to use it within 1 hour after they prepare it, and they have to discard it if the baby does not finish the bottle. And so they can't refrigerate it afterwards. So formula feeding guidelines. So we got to provide a lot of education on this for moms who decide to formula feed. So again, they need bottle and accessories can put in the dishwasher. You know, they should either boil them or wash them by handling use of hot soapy water. Some places already have like little sterilizing machines that they can use, but you know they should definitely be washing those with hot soapy water at every use, and at least maybe like once a week sterilize them in hot boiling water. You want to reinforce teaching with parents on how to prepare formula, so make sure that they mix accordingly to instructions. A lot of times what can happen is that the parent can dilute it, the formula, and put less formula and put more water, which is potentially harmful for the baby because we shouldn't be feeding them water, like in terms of just straight water. And they're not getting the adequate nutrients if they dilute the formula. Always check the expiration date when it opens because it does have a shelf life. Usually they should use sterilize the water by boiling water or use the store-bought nursery water. They should try to avoid using the tap water. But if they boil the water, you want to make sure that you allow it to rest so that it doesn't burn the baby's mouth. And there's different types of formula that they can purchase, so it's just kind of a matter of convenience. Usually the powder form is a lot cheaper than the one that's ready mixed, but one of the things that they gotta keep in mind is that the powder form, it's not sterile, and so it can be contaminated with bugs and stuff like that, so they have to be very careful, versus the liquid form it's sterilized. So they just gotta kind of decide what's best, what they prefer, and sometimes it's a lot of it's the convenience as well. With formula, they never should microwave the formula to warm up the bottle. It should be under warm running water or a bottle warmer, because again it also kills the nutrients in the formula, and as well it can have hot spots and can burn the baby's mouth. So again, we want to teach the parent about how baby's feeding well. So they usually, for formula-fed babies, they'll get weight gain. They'll usually have a different consistency of stool versus a breastfed baby. They'll have a yellow soft bowel movements and satisfaction of feedings. So I always tend to think of their bowel movements have a little bit more of a kind of like a peanut butter with the little chunky peanuts inside. That's kind of more of what their stool is. It should never be like Play-Doh type consistency. If the baby decides to not drink a formula, take it, or does not finish it, you cannot refrigerate it or reheat it later on. They have to discard the unused formula. Preparing large batches for a day, store immediately in the refrigerator, and feed within 24 hours. So for formula-fed babies, they should feed every 3 to 4 hours, and again, they must burp between feedings because these babies can get a lot of air in the bottle, and that can cause them to be fussy and cause them to be gassy. So they want to make sure that you check the flow of the formula from the bottle to ensure it's coming out, make sure that it's not coming out too fast. So that has to do with the nipples. So you want to kind of create a slow nipple. You purchase as newborns, and then as they get a little older, then they could get a more of a faster flow nipple for the baby. Because again, if it's coming out too fast, it can cause the baby to choke, or if it's too slow, that they're just sucking too much, so it may tire them really easily, and sometimes they can get a little frustrated, and then they can be swallowing a lot of air, and which can make them gassy. They should cradle the baby in a semi-sitting position, the way the mom is in this picture. She should never have the baby supine position, because that can actually be an aspiration hazard. She want to keep the nipple filled with formula to prevent the newborn from swallowing air. One of the important things that we need to educate our parents is to never prop the bottle. Like this baby's twins, if you look in the picture, they're propped by a teddy bear, because that can be a choking hazard for the baby. And also, we don't want the babies to ever sleep with the bottle in their mouth, because that can increase actually dental cavities, and it could actually go to their ears and cause an ear infection. So again, burp babies between feedings, or at least halfway through the formula. Burp the baby, discard unused formula in the bottle. And you always want to tell moms to assess for the formula tolerance in the baby, because if they're spitting up a lot, or they're vomiting, or they're constipated, that may need an indication, or sometimes they're really fussy. They may need to change the formula, and sometimes they may have to get something that's less gassy for them, or sometimes they may change to a soy-based formula. So one of the things with nutrition for babies, we want to be monitoring their adequate growth, and weight gain. So failure to thrive is slow weight gain, usually below the 5th percentile on the growth chart. Weights are done daily in the newborn nursery until they're discharged. So again, we're gonna expect to see them lose at least 5 to 10% of their baby weight. But then again, they should regain that by 2 weeks, and that's why we're constantly monitoring how much they weigh every time at every visit, to ensure that they're also growing. Every movement should be examined at the office within 72 hours. So again, usually within the first 5 days of birth, they have to, after they get discharged, they usually go to the doctor's office from the hospital, just to get that checkup. And then they have their consecutive visits after that. Growth is assessed by placing the newborn's weight on a growth chart, and adequate growth should be within 10 to 90 percentile. Poor weight gain should be below 10%, and too much weight gain is above 90%. So the newborn's length and head circumference are also routinely monitored, and they'll assess the mother's ability to feed her newborn, whether it's by breast or bottle. And again, that kind of helps them check in with the mom to see how baby's feeding, and then they can address any concerns, or if they need a lactation consultant to come and see the mom to help her with breastfeeding, they can provide that support at that time. And again, they'll calculate the newborn's 24-hour INO if indicated, to ensure that there's adequate nutrition. So risk factor for impaired newborn nutrition, these are risk factors for failure to thrive in newborns, and can be related to ineffective breeding patterns of the newborn, or inadequate breastfeeding by the mother. So newborn factors is that there's inadequate breastfeeding. So sometimes babies actually have poor sucking reflexes that can't adequately express the milk out. Some babies can be tongue-tied, where their bottom of their lip, their frenulum, is kind of like attached, and so they can't really, they don't have, their tongue is not able to have good sucking reflexes. Otherwise, sometimes it could be illnesses or infections that could cause it. So if they had thrush, it can be painful for them. Or some babies maybe have malabsorption, so it could be something more, some GI issues, or they have other conditions that increase energy needs. So for maternal factors, it can be inadequate or slow milk production. So again, we want to educate our moms to have good nutrition, drink lots of fluids. Sometimes, stress can affect breastfeeding, and sometimes it can be very stressful, especially for new moms when they're not used to this, and everything's all new, and they can so that that stress can also affect their breast production. So if they're not inadequately emptying of the breast, so that can be latch issues. If they're not putting the baby on the breast correctly, so sometimes that can affect the baby getting the proper nutrients. And so that's where the lactation consultant come in and assist her in helping her latch on the baby. Any inappropriate time of feeding, or inadequate breast tissue, pain with feeding, or maternal hemorrhage could also put them at risk for impaired newborn nutrition. So complications for newborn nutrition, there could be a special consideration when a newborn's receiving adequate nutrition, nursing interventions for the following newborns. So if newborns are sleepy, which they have a tendency of falling asleep, we tell the moms, unwrap the baby. Put them on skin-to-skin contact so that it stimulates them to stay awake. Sometimes changing the newborn diapers before the feeding or hold the baby upright and turn from side to side can help them wake up, or talking to the newborn or massaging their back or rub their hands and feet, or sometimes applying a cool cloth, because sometimes what happens is that babies will just fall asleep on the breast and then they don't get their good feeding, and then they're constantly waking up more often. So or sometimes babies just like to use the mother as a pacifier, and so we want to break that habit. So again, trying to wake those sleepy babies up to get them to feed. Or there's times that babies are just super fussy. So some of the things that we want to do is swaddle the newborn. So swaddling the newborn, because again, they come out of the utero, they're nice and little, they're kind of all flexed together and they're kind of nice and warm. So they like to be in that swaddling position. Hold the newborn close, move and rock them gently. Sometimes just reducing environmental stimuli, because these kids can get really overstimulated. So again, we want to avoid too much crowd or too many people because they can get really overly stimulated. And then sometimes just placing the baby on skin to skin. Sometimes, because again, that calms the baby down. It calms mom down, because sometimes moms could get easily frustrated when they have these fussy babies. And sometimes they just have to let them cry. So, and if mom gets frustrated or the parents get really frustrated, that puts them at risk of, potentially harming the baby. So sometimes just putting the baby in the crib and letting them cry is okay. It's not going to harm them. It actually helps their lung to expand. And just kind of walk away and take a quick break and then come back to the baby. Because again, sometimes, if the mom's really tired, they might, make her frustrated. So, like I said, just put the baby down and just give it a couple minutes and then come back down. Come back and grab the baby. Okay, so this concludes this lecture. If you have any questions, feel free to ask any questions. Thanks.